Good evening, everyone. We would like to welcome you to this webinar on dry eye disease. Thank you all so much for joining from different parts of the world. We are Autoyos, a global award-winning startup committed to transforming dry eye disease management with our innovative platform. We organize this webinar with the hope of providing valuable information and practical solutions to help people effectively manage dry eye disease. We are honored to have with us two renowned ophthalmologists, Dr. Mathew Kurian and Dr. Rushad Shroff. Before we start, I'd like to request everybody to make sure that your mics remain muted throughout the session. If you have any questions, please post it in the chat box. Keeping the time constraint in mind, as this session is about an hour long, we will try to address as many of those questions as possible. We'll start today's talk with Dr. Mathew, who brings with him more than 2 decades of experience. Dr. Mathew is a highly experienced, high-volume cataract and refractive lens surgeon with expertise in IOLs. And he currently serves as a medical superintendent at Chaitanya Eye Institute, Cochin.
Thank you, Anushka, for the kind introduction. First of all, I would like to thank Autoyos for this invitation to talk on dry eye disease and its management, which is a very important problem today. And I would like to congratulate Autoyos for its innovative approach to dry eye disease. And hopefully this will transform the way that we as clinicians look at dry eye and treat dry eye. So before we go on to the presentation as such, I would like to make sure to say that this is a presentation for general information, awareness creation, and educational purposes. It is not intended as a substitute for medical advice, diagnosis, and treatment. This presentation is not an endorsement of products or services. So we need to start dry eye by understanding what exactly the tears are and what it does in our daily life. So the tears are produced by the lacrimal gland, which is the water content of the tears is produced from the lacrimal gland. The goblet cells, which is present on the white of the eye, the conjunctiva, is what makes the water stick to the surface and retain it on the vertical surface. And on the eyelids, there are these meibomian glands, 30 to 40 in the upper and lower lids, which secrete an oily substance, which act like a scaffold and sandwich the liquid watery aqueous between the mucus and the meibomian gland oil secretions. And this washes and refreshes the surface of the eye, and that finally drains out through the lacrimal sac and the nasolacrimal duct. So if we look at a cross-section of the eye, you have the cornea there, and attached to the cornea is the mucus, on top of which is the largest component, which is the aqueous, and then holding it all in place together is the oil, which is the scaffold. And depending on what is missing, you have 2 types of dry eye. The oil absence causes an evaporative dry eye, and the aqueous absence causes a aqueous deficiency dry eye. And these are the 2 most common types of dry eye that are seen. So what happens during the blink of an eye? The tear film dries as the eye is opened. During a blink, oil and tears are secreted on the surface, and it is spread over the surface of the cornea. And this action happens repeatedly throughout a lifetime. So if we look at dry eye definition, it's a very complex and large definition, but essentially says that there are symptoms, which is what you and I experience if we have dry eye. And this symptoms is because of tear film instability. That vertical layer of fluid does not remain in place. And hyperosmolarity is basically a technical term which says that it is becoming much more concentrated, as a result of which there is inflammation and damage to the surface of the eye, and neurosensory abnormalities, which is pain and disturbances. So how do we capture these symptoms that the patients experience? Commonest is various types of questionnaires, and amongst the earliest one is a OSDI, or the Ocular Surface Disease Index questionnaire, which was developed by Allergan, one of the companies that work with dry eye. And a set of 12 questions creates goes into a formula, and depending on how you have answered it, you have individuals who are normal or with mild disease. Moderate disease is slightly higher, and severe disease is greater than 33 score on this one. So normals is less than 12, mild is 13 to 22, moderate is 23 to 32, and severe is 33. So based on this, you can grade how severe the disease is, and then there are slight modifications in the method of treating depending on the severity. So what do we understand by tear film instability? The normal blink rate is once in about 2 to 3 seconds, about 20 times in a minute. And the normal tear breakup time, this vertical layer of tears, dries up in usually more than 10 seconds of time. And typically in an individual, the blink happens before the breakup happens. And so a fresh coating of tears comes on the surface of the cornea and the eye. But in dry eye disease, what happens is either the blink interval increases due to concentrated work, there is some glare, or there is tear breakup time reduces as a consequence of a very dry environment, individual with evaporative dry eye, air-conditioned rooms, etc. And here the tear film breakup happens before the blink, and this is dry eye syndrome, or also very common in a digital eye strain, which I will come to a little later. So as a consequence of the breakup happening in the red over here, initially the tear film is protecting the ocular surface, then the breakup happens, and so there will be patches of unprotected ocular surface leading to discomfort and then damage, which is picked up in the form of staining on the ocular surface. And this cycle repeats, and chronic damage results in the symptoms that we see. So what is the impact on visual function? When we have an irregular layer, monsoon is happening now, rainy season, everybody is driving through this kind of an environment where the raindrops cause a loss of contrast. The scattering of light is appreciated as glare. You can see halos are double image, and all these are symptoms that individuals with significant dry eye can appreciate at some time or the other. But when you have a regular layer, as when you put on your wipers, then you have a regular layer of fluid, and that is what our eyelids do each time, acting like a wiper on the windshield. And then through that regular tear film, you can have good quality vision. Multiple tests are available. The commonest ones, the most hospitals or ophthalmologists will do, is called as a Schirmer's test or a tear breakup test. And these are simple tests that are done in the outpatient department. But more complex devices are there, which measure how concentrated the tears are. And we can also, just by a quick look on a slit lamp or a clinical examination of the eye, check whether there is congestion, inflammation, or redness. And the staining of the ocular surface, which is to pick up the damaged areas, is by putting a chemical called as fluorescent sodium into the tears, and that will highlight the damaged areas, which show up as spots or scratches there. And the neurosensory abnormalities or the pain discomfort, a lot of research has been done on this as to why this happens, and that has been published by my former colleagues at Bangalore. So, commonest form of dry eye is evaporative dry eye, or which is associated with the meibomian gland dysfunction. So when we press against our eyelids, what we find is that on high magnification, you can see clear droplets of fluid or tears coming out of the small glands that are there on the tears on the lid surface. In slight disease, you will find that instead of a clear watery material, you have a more milky material. In more severe disease, you will find that it will become a little more thick, curdy material. And in the final and worst grade, you have like very thick noodle toothpaste kind of material there. And this obviously means that there is very little wetting or very poor quality wetting of the ocular surface or the eye surface happening in this situation. And the treatment for this is hot fomentation. I'll go into that in a little more detail. Basically, it increases the eyelid blood flow. It gradually melts the solidified tear secretions, and some amount of eyelid massage can unblock the tear glands. Consequences of all this blockage happens is concretions or this white kind of nodule, which is basically dead, deceased, and unhealthy material which got stuck inside on the inside of the eyelid. Or sometimes you can have what is called commonly as a sty, which is like a pimple on the eyelid. And here again, hot fomentation acts both as treatment as well as prevention, along with the antibiotic drops and ointment for the local infection, and anti-inflammatory or analgesic tablets to reduce the swelling and the pain. So that would be the treatment. Why does this happen? Because there is a device called as a mammographer. Mammography is basically the technique of using special infrared light to image the inside of the eyelid and see how much of the glands functioning normally. When there is abnormality, some degree of the glands get blocked, and that is called as gland dropout. And in very severe disease, you can have up to 75% of the glands being dropped out. And these individuals will be having very severe evaporative dry eye disease. We want to ensure that, people are identified much before it becomes this last stage kind of disease. And the treatment is offered to the individual at first level, degree 1, where less than 25% of the glands are damaged, and they can continue to have a comfortable, healthy eye. So in terms of prevention and treatment, hot fomentation is essentially the first treatment of lid hygiene, which is to soften the oils. You want to ensure that you don't have a very boiling hot water. You dip a towel, preferably a thick material like a Turk towel, and apply it to the eyelids. Here you can see that the person has tested the temperature of the towel on the hand before applying it to the eyelids. For 5 minutes, morning and evening is good enough. And for people who find that cumbersome, there are various silica gel devices which can go into a microwave, and then it will give the same function. Lid hygiene is basically, there will be a lot of dried up debris and unhealthy secretions on the lid margin, and you want to use a earbud which is moistened. You can add a Johnson's baby shampoo, something like that, which doesn't sting too much, or you can use these kind of pre-prepared eye drapes to get the same effect. And along with this, there will be obviously substitute teardrops to be applied to the eye. You just pull the lower lid down while looking up. It will go into the small gap that is there at the bottom. Important things to remember: no eye rubbing. The other important thing to remember is a misconception that washing into the eyes with water or other fluids will improve the dryness condition. Actually, it worsens the dryness, because whatever fluid you put in, if it is not specifically formulated to go into the eye, it will change the natural chemical balance that is there, the acid-base balance. It will cause stinging. It will remove or dilute some of the chemicals and other materials there which protect the eye from drying, allergies, and infections, and worsen the situation. Aqueous deficiency dry eye is a less common situation. basically the eyes do not produce adequate amount of tears. And so the first step is to try and stimulate the lacrimal gland to produce more tears, which is one of the methods. The most common method is supplementation in the form of artificial teardrops or sprays. And finally, you have retention. So whatever little is being produced naturally, if you block it from getting drained into the nasolacrimal duct, then you'll have a better lubrication and moistening of the ocular surface. Let's move on to computer vision syndrome now. So computer vision syndrome, actually the nomenclature is now changed. It's now called as digital eye strain, and it includes all screens, whether it is mobiles, tablets, laptops, desktops, or TVs. And the general rule is that the working distance for mobiles or tablets should be about a foot. For laptops or desktop, about 2 feet, and televisions larger the screen, of course, at least 10 feet. And this rule will essentially ensure that your eyes are more comfortable working in that situation. Why does digital cause a problem? Because each of these pixels, it's not a sharp cutoff between the alphabet and the background. So you will have very dense coloring in the center, and then there is a slight fade off of the pixels, and then you have the background color. And just looking at this tends to give you a feeling of a headache, because your eyes are trying to judge the focus and continuously working, and the eye muscles tend to get tired out like that. Whereas in print, typically a hard copy will have a very sharp edge between the background and the alphabet, and so it's much easier on the eye. So what are the symptoms that are likely to happen in individuals, and how frequent are these symptoms? So we have data to say that more than 80% of people in the US work on screens for more than 2 hours per day. And of these individuals, 2 out of 3 blink a lot less than normal. So it's not 20 blinks in a minute, it's probably 10 or 15 blinks a minute, and that causes the drying to happen. As a consequence, about 90% of them can have various symptoms, and these symptoms include eye strain, headaches, blurred vision, dry, burning, and irritated eyes. What can we do to prevent this? Spectacles. Even if there is a small power, you use it to reduce the strain. It's not so critical when you are not on a digital mode, but if you are on a digital screen, then it's better to wear even the smallest power that is required. Use anti-reflective coatings because they reduce glare. Try to consider tinted or photochromatic glasses if brightness and contrast issues are there. And in individuals above the age of 40, those who are using desktops and laptops, progressive lens should be considered. And this will give coverage of near, intermediate, as well as distant vision, because it's got segments for all 3. If you use a classical bifocal, you have distance and near only. And so reading glasses or bifocals will cause an abnormal posture, because you tend to look through the bottom portion of the lens and tend to lean in towards the computer to get to the appropriate 30 to 40 centimeters from the screen. And over a period of time, that will cause back and neck problems. So workplace ergonomics, and today with a lot of work from home, even at home, this is very important and you need to remember it. The chair should be comfortable. The screen working distance rule I have already mentioned. And we need to have a large matte finish screen with less glare, a high refresh rate and resolution, and where possible, increase the font size. So this is what we call as a setup. And in an office, it is often professionally done. And so it's usually correct. Work from home, there is more flexibility, and sometimes things can be not ergonomically correct. The heating ventilation, if there is a lot of cool breeze coming onto the eyes, that becomes a problem. And the light, typically what they say is that the light in the room should be one half of that of other rooms in the office or house, and the computer screen brightness should be equal with the environment. The 20-20 rule is to take a 20-second break for every 20 minutes of work by looking at something 20 feet away. And we tend to forget to get up because you are typically hunched over, and this is supposed to be the new killer, and it's supposed to be worse than smoking. We need to wet up. We need to remember to blink and use tear supplements for lubricating the eye surface. Special formulations are available in specific situations, and there is some role of omega-3 fatty acid capsules to improve the tear film quality. Important to remember is digital well-being. Most of the apps, most of the tablets and laptops have these things in the apps, which is the app timer and ability to wind down. It will surprise you when you look at this, the amount of hours you spend. So you connect to app timer, turn on the wind down, and the screen glows blank as you reach the time that you have set for yourself to wind down. Adaptive brightness is basically to ensure that your screen brightness is equal to the room brightness, and you can just slide this slider to get it to that appropriate level of brightness. You also have dark mode, and both of this can be set. In my mobiles, it is basically sunset to sunrise, dark mode, as well as adaptive brightness, and this blue light filter, which gives a yellow tinge to the screen. Screen rules for children. There is approximately 100% use increase because of COVID. Screen addiction is an illness, and it is associated with the likelihood of myopia or minus power in children. And so in several countries, the prevalence or the frequency with which children are having to wear minus glasses is so high that decisions have been made by government to try and reduce this. In India, with online classes happening till last year, no educational calls for children less than 3 years, less than 90 minutes in children up to 6 years, 2 to 3 hours per day for up to 12-year children, but with a lot of breaks, and up to 16 years of age, 6 to 8 hours maximum, but with again breaks to ensure that the eyes get some time to freshen up in between. The screen rules: parents need to activate parental control features, set rules about the screen use, and educate children about how to use the internet safely and be vigilant. To prevent refractive errors in children, the likelihood of minus power, 2 hours of outdoor activities is recommended. And these 2 hours of outdoor activities with exposure to sunlight, vitamin D increases, they should be activities which involve distance vision and not anything close by. So to recap, we have had some understanding of tears. We've discussed dry eye disease, digital eye strain, and the basic 3 things about setup, get up, and wet up. We have discussed digital well-being, screen rules for children, and I've tried to clear some of the misconceptions associated with dry eye disease. Thank you for your attention.
Thank you very much, Dr. Mathew. That was a very insightful talk. Before we move on to the next topic, we can now try to answer some of the questions that had been raised by our participants. We have a question here about that says, is dry eye curable? And as someone in the comments pointed out, what are the ways to increase awareness for dry eyes?
So dry eye, strictly speaking, is not a curable disease. You can prevent it. And I think being aware of it is the first step in prevention. Maintaining digital well-being and trying to limit screen time, especially in children, is something that will ensure that it is preventable. Once you have dry eye, and if it moves from, let us say, mild dry eye to moderate or severe dry eye, the likelihood of you being able to reverse the entire process and come back to normal, completely clean eyes is little low, but you can be essentially much more comfortable. Instead of having very uncomfortable eyes, you can reduce the severity of discomfort. You can reduce the frequency with which you have discomfort. And by maintaining the preventive features, hot fomentation, lubricating drops, and digital well-being, you should be able to lead a comfortable life.
Thank you very much. We have another question, which is, how do you avoid ocular discomfort during peak allergy season?
I think there we have to remember that we shouldn't rub the eyes. Allergy is as such causes itching, and rubbing the eyes makes it a lot comfortable. Using lubricants, anti-allergy drops, sometimes if required, tablets also will ensure that you don't rub your eyes, and you are able to reduce your symptoms. And leaving your eyes without rubbing is, I think, crucial to ensuring that you're comfortable. There are methods of actually identifying what the particular allergen could be. It could be smoke from vehicle exhaust. It could be industrial pollutants. It could be pollen from the air. So it could be house dust, dust mites from your bed, etc. And it's a more complex method of figuring it out, but essentially treatment remains the same.
Okay. We have another question from the comments, which is, you were talking about baby shampoo, but it is not recommended anymore in Europe and US. What do you think about it?
Just moistening the tip of the bud is adequate to, first you need to do hot fomentation to soften the secretions. Second, you need to do the moisten with mildly warm water, and then you should be able to clean it. If there are scabs which are fairly resistant, then using baby shampoo, which is not stinging. Adult shampoos will sting the eye significantly. Then you can use a baby shampoo, but just moistening with warm water is more than enough most situations.
Thank you. We have one more question. Tips to select the teardrops?
There are vast majority of drops available. You have formulations like hydroxypropyl methyl cellulose, carboxymethyl cellulose, 5% drops, 1% drop, 0.5% drops, 1% drops, and polyethylene glycols. So some of these are available off the shelf without a prescription. And you could try some of those initially, but I would recommend that if symptoms are not disappearing or clearing up within a few days of using it, it's better to get an eye checkup done by an ophthalmologist and then proceed with treatment rather than self-medication, because some of you would have seen in the news terrible consequences of self-medication using lubricant drops in the US, which caused the recall of some of the brands. The entire stock in the country was taken off.
Thank you very much. We have another question. How do you distinguish between dry eyes and neurological symptoms masking as dry eyes?
So that would require a proper ophthalmic evaluation, and sometimes along with the ophthalmic clinical evaluation, some imaging may be required. Neuro-ophthalmologist or a neurologist may also need to come into the picture to be able to an ophthalmologist may need to work with a neurologist or a neuro-ophthalmologist to be able to make that distinction. So it's not something that is easy, and it's not something that can be done by the patient or individual at home.
And we have another question. Is dry eye disease an age-related disease? What care should elders or senior citizens take?
So the prevention aspects and the treatment aspects are actually quite similar in the sense that hot fermentation, keeping the glands open, functioning, and preventing them from getting blocked is critical. Use of substitute lubricants is common to both treatment as well as prevention. In a sense, it is more common in the elderly, because if you look at people in the 50 to 60 age group, the group that comes in for cataract surgery, a topic which will be touched on by Rushad next, you will find that approximately, depending on where you are studying them, approximately 25 to 40% of them, so almost 1 out of 2 individuals, is likely to have some aspect of dry eye in that age group.
We have another question. What is the role of tear inflammatory markers, which are obtained via tear test analysis?
So what they're trying to do there is to try and give some sort of a targeted treatment. So instead of using just a substitute in the form of a lubricant, they are trying to see whether specific inflammatory markers in the tears are causing the problem, and whether there are specific targeted methods to reduce those specific inflammatory markers. So like, you may have interleukins which are high in some type of dry eye. You may have tumor necrosis factor, etc., which may be different in different situations. So this is a new and exciting approach to understanding what role inflammation plays and how the inflammation cascade causes the end damage, including some of the symptoms related to pain and discomfort, and whether targeted treatments could be customized to each individual patients.
Thank you very much, Dr. Mathew. Before we move on to the next speaker, we just wanted to say that at Autoyos, we have been focusing on building scalable and effective solutions for both eye care seekers and eye care providers. As a first step, we have developed a preventive care tool, an app called ID, to help screen users avoid screen time induced eye strain. We have received a wonderful response from almost 1,000 users during public beta testing. So here's a quick overview of what we have developed so far. I hope that got at least some of you excited about what we have working in the pipeline. Our second speaker for today, Dr. Rushad Shroff, is very accomplished with over 12 years of experience in the field of ophthalmology. Dr. Rushad is a highly proficient anterior segment ophthalmic surgeon, skilled in different cataract surgery and refractive surgery techniques, as well as corneal transplants. He currently serves as the medical director at Shroff Eye Center, Delhi. Dr. Rushad, if you want to start.
Thank you. Thank you for that very kind introduction, Anushka, and thank you to Team Autoyos for having me here. It's a great pleasure to be part of this interaction and to disseminate this information. And kudos from the video. It was a very nice video. I've used the app myself also, and it's quite a nice app to use. So without further ado, I'll just start off with my presentation. So is the screen visible to everyone?
Not yet.
Okay, 1 second. Let me just share it. Is it visible now?
Yes, Rushad, you are visible.
Okay. So I'm talking about dry eye in specific situations, including after cataract and after LASIK surgery specifically. So the outline of my talk is basically, why does dry eye happen after eye surgery? Is it important to treat the dry eye before surgery? What are the common symptoms of dry eye post-cataract and LASIK surgery? And how do you reduce the occurrence of dry eye after cataract and LASIK surgery? Along with this, I'll be taking care of a few questions which are routinely asked in the OPD, where there are certain myths that we need to clear regarding eye surgery and dry eye. So the causes for dry eye after either a cataract or a LASIK surgery, the primary cause is the incision. Now, nowadays, people believe that since the procedure is being done by a laser, there's no incision. The laser is not a magic process in that sense. It does create an incision. In a LASIK surgery, there's a flap that's created in the cornea, and that is where the incision is. And in a cataract surgery, there's an incision through which our ultrasound machine goes into the eye, breaks up the cataract, and through the same incision, we then insert the intraocular lens, which actually clears our vision. So the first thing is these incisions cause a little damage to the nerves that innervate the cornea, and therefore patients develop some amount of irritation or dry eye post these surgeries. The second thing is that post-surgery, we do end up giving a fair number of drops. This includes antibiotics or steroids to help with the healing of the eye. And generally, these eye drops have preservatives. Now, preservatives are not a bad thing. They enable us to actually use the eye drops and for the eye drops to be viable for a longer period of time. However, they do certain types of preservatives like benzalkonium chloride or polyquad or other compounds like that. They do have an impact on the tear film, as Dr. Mathew had alluded to earlier. So what happens is that the preservatives in those eye drops tend to disturb the tear film, and that can also lead to symptoms of dry eye post-surgery. There's also a change in the constitution of the tears in terms of osmolarity, like we mentioned, increased concentration of the tears. And of course, things like evaporation of the tears become affected post-surgery. So you have conditions like meibomian gland dysfunction, which may be existing beforehand, but tend to cause more symptoms post any of these surgeries. Now, detection of dry eye before surgery is very important. So if a patient typically turns up in the OPD and is already complaining of dry eye before cataract or before LASIK surgery, it's important to pay attention to those symptoms. The symptoms can vary from grittiness or heaviness in the eyes to foreign body sensation or irritation. Sometimes, paradoxically, patients complain of watering in the eye. Dry eye, normally you would think, is a condition that causes dry eyes. But what happens paradoxically is that sometimes, because the tears are deficient on the surface, there's a reflex watering that occurs in the eye, and therefore the eye becomes wet. It's important to educate your patient beforehand, before taking them up for surgery. Things like the ID app would also help in things like this, where you educate them about blink hygiene, maintaining their blink rate, ensuring that the blinks are complete, doing things like hot fomentation in case the patient has detected MGD beforehand. Screen hygiene, setting up your environment to work is extremely important as well, ensuring there's adequate lighting. Also ensuring that your screen light is not too much and should be consistent with the ambient light around you. Ensuring you're using larger screens, comfortable font size that do not put strain on the eye. Of course, ophthalmic visits are also very important. In case a person has dry eye, we would encourage them to meet their ophthalmologist fairly regularly. The tests that are done in the clinic prior to surgery, as Dr. Mathew mentioned, the Schirmer's is a test that measures the amount of wetting of the paper strip that's placed in the eye, that actually measures the aqueous component of the dry eye. The tear breakup time is done either by staining the eyes with fluorescein stain, which is a yellow colored or orange colored stain, which actually enables us to determine the rate of evaporation of tears. There are machines, which I'll show you a couple of photographs going forward, that also determine the tear breakup time without actually inserting fluorescein dye into the eye. Meibomian gland analysis, as we looked at, where you get an image or a photograph of the meibomian glands that are present in the eyelids that secrete the lipid layer or the oil layer on the tears, and measuring the thickness of this lipid layer. There are devices which do that with interferometry or different techniques that actually measure the thickness of the lipid layer or the mucus layer in the tears, which gives us vital information. So the image on the top left is actually what is called non-contact TBOT, where you can see that it measures the amount of seconds that the tears actually break up in. Normal is greater than 10 seconds, but as you can see in this example, it's breaking up a little bit earlier. We also subject the patients to speed questionnaires or OSDI questionnaires to actually understand their symptoms. And of course, the images on the right show the lipid layer analysis and the meibography, which actually measures the meibomian glands in the eyelid. So why is it important to treat dry eye before surgery? Because there are certain problems that one can encounter. One is it affects the accuracy of your surgery in the first place. Because cataract and LASIK nowadays, we look at removing refractive error or correcting your spectacle number in these surgeries. It is important, therefore, to get accurate measurements, because our lens power calculations are based on the shape of our cornea as well as the length of the eyeball. So it is extremely important to get accuracy in these measurements, and dry eye tends to interfere with that. So it is exceedingly important to treat the dry eye before taking these measurements, especially for things like intraocular lenses. There are lenses nowadays that we use, which are called multifocal lenses, where you can see for distance as well as near, and your computer vision without glasses. Now, these are lenses that work very well if you have a very good ocular surface, a very good optical system of the eye. However, in dry eye, again, these lenses don't tend to work as well. As Dr. Mathew had shown, there is glare, there is scattering of light because of the dry eye, and that compounds the problem if you have a multifocal lens in your eye with that. So it's very important to treat these conditions beforehand. Again, measurement of the corneal shape, which is done by a topography device before LASIK and cataract surgery, is extremely important. And this is also affected by your tear film. So a tear film which is not proper tends to cause errors in measurement of corneal shape, and therefore errors in the treatment that is done with the LASIK machine or with the implantation of intraocular lenses. So the problems that occur after surgery, if you do not treat the dry eye beforehand, is things like common complaints, and I'm sure a lot of people would have felt that as well. There is some amount of irritation or heaviness in the eyes. The visual quality disturbance, as I've shown in this image here, very often inside a clinic setting, the patient reads till the last line, which is a 20/20 or a 6/6 vision, but the quality of vision is not great. And as you can see, the E image here, this is from a machine called the eye trace that simulates vision. What you get is a shadowing or a blurring of the edges of the alphabet. And this is very disturbing to patients post-cataract and post-LASIK surgery, where all conventional tools of measurement say that the vision is good. However, the practical quality of vision in everyday scenario is not really that good. It can also lead to quicker evaporation of tears, which again affects the optical quality of images, and a poor lipid layer in our tears. So as we mentioned, prevention is the best cure. treating early is extremely important, and actually understanding what is going on is also important. So the first thing, if you have a dry eye, the most common thing to do is to start with lubricant eye drops. The question was asked which lubricants. Any lubricant generally does fairly well. However, it is important to again meet an ophthalmologist before deciding on a particular lubricant. In case of MGD or evaporative dry eye, it is extremely important to do warm compresses. You can either do this with cotton boiled in warm water or with a warm towel kept over the eyes for about 10 minutes or so. Make sure it's lukewarm. It shouldn't be extremely hot. There are masks that you get these days which can be microwaved and then used. These are silica-based masks which you can heat in a microwave and then apply around the eyes. They generally have a Velcro strap and an outer covering of cloth which can be washed. So they're reusable, and you can use these for up to about 6 months or so. Blink and screen hygiene, as I mentioned. If there are other problems like arthritis, now specifically conditions like rheumatoid arthritis or collagen vascular diseases or autoimmune conditions, those are fairly commonly associated with dry eye. Now, if you have these conditions and you are planning to undergo a cataract surgery, it is important that these conditions are well under control, which means that in consultation with your rheumatologist or with your physician, it's extremely important to step up systemic medication to control these conditions, and only after that undergo the cataract surgery. Otherwise, there can be problems like deficient healing of the incisions that we make or a severe dry eye post-surgery. Collagen vascular diseases like rheumatoid arthritis or diabetes or uncontrolled diabetes are contraindications for LASIK. So you would not do a LASIK surgery or a refractive surgery in patients who have these conditions prior to the procedure. And of course, if an MGD is detected, there are treatment options like vector thermal pulsations or intense pulse light therapy, which can also be done in addition to warm compresses, which also help to alleviate symptoms and help to prevent problems post-surgery. Another very common deficiency is vitamin D deficiency that a lot of us suffer from. If the vitamin D is extremely low, it is important to take injectable vitamin D. If the vitamin D is in the moderate deficiency range, then oral supplementation using sachets or with oral tablets every week is important for a few weeks. It is important to recheck the vitamin D levels later on, because vitamin D is not like vitamin B or other water-soluble vitamins. It tends to accumulate, and therefore hypervitaminosis or excessive vitamin D is also a bad thing. So it's important to check this once you've done your supplementation to make sure it's not gone too high and that it's maintained in the normal range. So I'm just going to answer a few questions that have been commonly posed to me in my practice as well. Now, one very common question is, do different LASIK machines affect dryness in the eye? And the answer is no. There's no difference between different LASIK machines as such. However, the position of the flap may make a difference. What is called a superior hinged flap may tend to cause a little more dryness than a nasal flap, because that transects the nerves which innervate the cornea a little bit more. There are different procedures like lenticule extraction procedures and implantable Collamer lens, which cause little less dry eye because they affect the surface less. So LASIK is a procedure where a flap is created in the cornea. The anterior structure of the cornea is elevated in the form of a flap. It's kind of like opening a book. And then the laser does the treatment under that, and we put the flap back. Lenticule extraction procedures have smaller incision and less effect on the corneal nerves, and therefore studies have shown that there's less dry eye following these procedures. In a PRK, which is a photorefracted keratectomy, there's no incision, just an ablation. So again, there is better preservation in terms of the corneal nerves. And ICL is an implantable Collamer lens where the procedure is done a little differently. You insert a lens in front of the natural lens of your eye. This is generally for treating higher powers. And because there's a small incision again in this, the frequency of dry eye is a little bit less post ICL. So this is a diagrammatic representation of what happens to the nerves. You can see this yellow line is the flap line in a LASIK and there's more damage to the corneal nerves. You can see those white lines are missing in the image on the left, whereas on the image in the right, the white lines are more marked, which shows that there's less damage to the nerves in the cornea. This is actually done with a machine called a confocal microscope, which takes very, very magnified images of the cornea at different depths. So this is just an illustration to show that lenticular extraction procedures may be less damaging to the nerves and therefore cause a little less dry eye. Another common question before LASIK that has been asked is whether dry eye is permanent after LASIK. Generally, no. It's most commonly dry eye lasts for a few months after LASIK because there is some amount of time that the corneal nerves take to regenerate after that. It can go on for a few months, but that is more common when there is some amount of pre-existing dry eye, and therefore it's very important to treat that before we go ahead with the surgery. And very, very rarely it is chronic and then needs further evaluation and treatment for other systemic conditions like I had mentioned earlier. Another common complaint is that vision is blurred after LASIK or refractive surgery. So blurry vision, as we have shown in previous slides, because of scatter and because of loss of contrast, can happen after surgery because of dry eye. Dry spots on the cornea can cause scattering of light, and this can cause some amount of fluctuation in the quality and quantity of vision initially. Typically, what patients post-LASIK do complain of is that in the morning, the vision is a little blurry, and as the day progresses, it tends to get a little bit clearer. So that may be because of some amount of dry eye overnight. Sometimes people sleep with their lids slightly open, that can exacerbate the dry eye. So as soon as the lubricant is put in the morning, generally the quality and quantity of vision improves. The caveat is that if there's very blurred vision after a few months of LASIK, it is important to get it checked by a surgeon, as it may not always be because of dry eye, and there are other conditions that can also cause blurry vision, and therefore at that stage it's important to kind of get it checked out. Very commonly after cataract surgery, patients ask, did something go wrong in the surgery when they have this kind of irritation in the eye? Generally, the answer to that is if the vision is good after cataract surgery, it means the surgery has been successful. Symptoms like heaviness, tiredness in the eyes, and irritation are generally symptoms of dry eye. However, this does not mean that something has gone wrong in the surgery. And generally, the thing to remember is that the dry eye becomes worse after surgery. So that is something to just be aware of, give it a little time to actually heal. The other thing that is in vogue these days is laser cataract surgery. And very often patients ask, does the laser cause less dry eye? So femto laser cataract surgery is in this femto laser, which is similar to the laser in LASIK, creates the incision into the cornea and it creates the opening into the lens capsule and it fragments the cataract. So this creates an incision which is about the same size as the normal incision through a microincision cataract surgery. So there is not much difference in terms of the amount of dry eye between this type of cataract surgery and standard phacoemulsification surgery, according to most publications. So doing a laser does not necessarily mean that you would not have dry eye post cataract surgery. So these are just a few slides on what are our treatment devices. This is what is called a LipiFlow or vector thermal pulsation device, which can be done prior to cataract surgery if there is MGD or blockage of the meibomian glands. The image on the right shows the contact lens that goes into the eye, and this actually does a massage of the eyes. It's kind of like an eye spa. This is so what happens is there's a kind of pulsation that happens that which applies heat and pressure, and it lets the secretions come out of the blocked glands, and therefore it improves the lipid layer and reduces evaporation of tears. This is another kind of therapy which is called intense pulse light therapy, which uses broad spectrum light. Basically, the principle is that the light is converted to heat energy, which decreases the blood vessels or near the lids, and it liquefies the solidified meibum. This helps to again release the oil layer out onto the tear film and therefore prevents evaporative dry eye. So with that, I would like to conclude, and a big thank you to everyone for patient hearing. Thank you.
Thank you, Dr. Rushad, for that informative presentation. That was amazing. We can now try to answer some of the questions that have been raised before. Are there any new treatments in the horizon for dry eyes?
So these things which I showed the last few slides are the newer treatments, this intense pulse light and the vector thermal pulsations. There are, of course, always compounds that are being looked at. There are things like repapamide and other drugs which are being looked at in the market, which target specifically certain inflammatory mediators. And those are being looked at as newer treatments as well. So these are kind of the latest innovations in dry eye treatment as far as that goes right now.
Oh, okay, thank you. And any tips on post-cataract care to avoid dry eyes?
So like I mentioned, first thing is to kind of diagnose this pre-operatively and to make sure that that is taken care of beforehand. If you are on if you have certain other conditions, like I mentioned, like autoimmune conditions, like rheumatoid arthritis or SLE or any of these kind of conditions, those have to be taken care of. It is important to treat the dry eye in terms of evaporative dry eye with warm compresses. In fact, we had done a study on this and found that patients with cataract surgery who were treated for MGD or evaporative dry eye before surgery tended to do a lot better in terms of their symptoms post-cataract surgery, and not only their symptoms, but their tear film parameters, like measuring the tear breakup time, the evaporation rate, the lipid layer thickness. All this tended to do a lot better post-cataract surgery, and the effect stayed for longer. That meant it continued for 3 to 4 months post-cataract surgery as well.
We have another question. Do you use cyclosporin regularly for all your post-refractive surgery patients? And how many months post-op do you normally keep them on artificial tears?
So post-refractive surgery, I normally keep them on artificial tears for about 3 months on an average. And if someone has got complaints of dry eye, then I would keep them on it for longer. Cyclosporin, I don't use in every kind of refractive surgery. I use it more in PRK to prevent haze and to reduce the amount of ocular symptoms that they have. I do not use cyclosporin in every single refractive surgery I do. However, if a patient does have some amount of dry eye complaints post-refractive surgery, we do add cyclosporin to the protocol as well.
And can topical meds for dry eye cause heart condition?
Topical meds for dry eye generally would not cause heart conditions. There are certain anti-glaucoma medications which can affect heart conditions. So in those cases, those should be avoided. Anti-glaucoma medications can exacerbate asthma as well. And they do actually cause more dry eye because they do have a fair amount of preservatives as well. So those are the medications that generally cause it. Dry eye medications as such do not. So very, very severe aqueous deficient dry eye, sometimes systemic steroids are given, which can have an effect of congestive cardiac failure and things like that. But that would be a very, very rare occurrence. So generally, topical lubricants or topical eye drops would not cause this as far as dry eye medication goes.
And what kind of device-based treatment do you currently use, and how do you feel about the results?
So a device that we have now access to actually both these kind of devices, which is the intense pulse light as well as the vector thermal pulsation devices. So we are using both of these. There are different subsets of patients who do well with each kind. The MGD variety, where there's blockage of the meibomian glands, and generally you would analyze the meibomian glands before going in for any of these treatments. If there's obstruction without destruction of the meibomian glands, the vector thermal pulsation tends to do very well in those patients. There, the IPL, what I found is generally better. The intense pulse light is better for patients who have acne, rosacea, or skin conditions associated with dry eye, because sometimes those are associated, and that it helps with the blood vessels and the supply to the meibomian glands in those conditions a little bit better. So you can use these in conjunction with each other also in these patients who have a combination of evaporative and aqueous deficient dry eye, and both tend to help in that.
Thank you very much. We have another question. Kindly highlight your principles in managing dry eyes in patients with inflammatory systemic diseases like arthritis, etc. If you could also shed the same light for diabetes, then that would answer another question as well.
Sorry, I didn't catch the first part of that question.
Kindly highlight your principles in managing dry eyes in patients with inflammatory systemic diseases like arthritis, etc.
Okay, so the first thing that we normally do is we do a workup for them, which is we do certain blood tests, apart from the eye-related tests that we mentioned, which we would do in every dry eye patient, and the questionnaires that we administer to understand their symptoms. We also do blood tests to understand whether the arthritis, what is the cause of the arthritis or the autoimmune condition. So there are tests like RA factor, ENE, C-ANCA, P-ANCA. There are various different tests that we do to actually understand what is causing the dry eye. Generally, we treat this in conjunction with a rheumatologist, because they may have to put the patient onto drugs which are steroid-sparing immune modulators like methotrexate or other drugs like that, along with steroids. We generally treat it in conjunction with the rheumatologist. And diabetes, it has an effect on the nerves that innervate the cornea, and therefore it has an effect on dry eye in that sense. But strictly speaking, it doesn't affect the tear film that much.
We're also live on Facebook, so we have a question from a viewer. I have high interleukin in blood serum. What could be the causes?
Interleukin is, again, it will be a very broad term. You would have millions of interleukins that could be high. So you would have to go into a workup. So cyclosporin targets IL-2 or interleukin-2, but interleukin itself being high, there may be various different types of interleukins that could be high.
Okay. Any tests to determine inflammatory markers in the mebum or acne?
So the inflammatory markers you would take from basically, you get either Schirmer strips where you can use those and then take them to a lab, and flow cytometry to kind of understand what is the kind of protein level or different inflammatory markers in that. And the other way is you can use a micropipette to kind of take that out. But that would be a combination of aqueous, mucus, and lipid layer that comes into that, because you're taking the entire tear film. I don't think there's any specific way only to analyze the mebum separately, because it tends to mix in with everything else.
We have another question. Is it fine to go for contact lenses or IOLs while having moderate dry eye condition? Will it lead to more dryness?
So contact lenses affect the blink rate again, and they do tend to increase dry eye. So it's important to get checked as to what the level of the dry eye is if you're using lenses, because it does tend to increase the dryness a little bit. Intraocular lenses are inside the eye, so they would not tend to increase the dry eye in that sense. But I mentioned the various causes related to surgery which can cause increase in dry eye. So contact lenses, again, pre-LASIK, we generally ask the patient to be off contact lenses for a bit, again, to get an accuracy in the measurements that we take for refractive surgery. So yeah, that would be how we would normally do that.
I think if I may add a point over here regarding contact lenses, one is the duration of contact lens use in the day. The second is to definitely not fall asleep with the contact lens on. And thirdly, if an individual with dry eye disease wants to use contact lens for, let us say, a function or a specific event, to consider the use of daily disposable contact lens, because that would prevent protein disposition on the contact lens itself, as is seen in reusable contact lenses, annual, monthly disposables, and that can exacerbate the cycle of inflammation and be a trigger for dry eye.
Thank you very much. Our final question for the evening. Do dry eyes lead to retina holes?
The retina is right at the back of the eye, and myopes can have retinal holes. That means people with minus numbers, but that's because the eyeball tends to be a little larger. There can be stretching of the structures, and you can have lattices or weak areas in that which form holes. But dry eye itself would not cause retinal holes or retinal pathology in that sense.
Thank you so much for answering all of these questions. I would like to extend my heartfelt gratitude to both our wonderful doctors for generously sharing their valuable insights and expertise during this webinar. With that, we will conclude today's webinar. Thank you so much for joining us today, and we sincerely hope that this webinar was helpful to you. If you have any suggestions or feedback for us, you can reach out to us at info@autoyos.com. Please follow us on all our social media handles for any updates on any new events or any new webinars, and have a great night. Thank you again, Dr. Mathew and Dr. Rushad.
Thank you.
Thank you. Thank you very much.